first jump we're going to have Katie here do is what's called a wall or a block jump. She's going to turn here. We want to be about shoulder width away from the wall. Once again, we're emphasizing all the joint mechanics that we've been stressing throughout the protocol. She's going to start with her knees flexed, hands on the knees, and then she's going to jump up, touch the wall, land in that soft position, watching her joint alignment. She's landing toe to heel, absorbing the energy with her ankles, her knees, and her hips. We're going to do this for 20 seconds to begin with. Throughout the protocol, the time is going to change. She's keeping great form. She's decreasing that amortization phase. This first 2-week phase of the jump program, we want to really focus on mechanics. Form, form, form. Okay, good. And that is a wall or a block jump. One of the most difficult jumps we do throughout the whole program is called a tuck jump. This is a difficult jump to do in that it requires an enormous amount of strength, balance, and proprioception. Form is key on this. We need to really watch this. So for this jump, we're going to have her get down in a squat. She's going to jump, bringing her legs up as high as possible, landing toe to heel, soft landings. At any point during this exercise, if you see faulty movement patterns, we have the athlete stop. So that is a tuck jump. We just want to make sure athletes maintain good form throughout that jump and make sure that we see good joint mechanics. The progression of the broad jump goes into a jump called jump, 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 vertical jump. It's 3 consecutive broad jumps followed with 1 squat jump at the end. So she's going to get into a ready position. She's going to land heel to toe, 3 broad jumps. This last jump, she touches the turf and explodes, landing in that knee flex position. And we're going to repeat this 5 to 10 reps. And that's jump, 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 vertical jump. The next plyometric we're going to do is called a squat jump. For this jump, we're going to have the athlete get shoulder width apart. She's going to reach down and touch the turf, keeping that good alignment, and jump up, reaching for the ceiling, landing with good alignment. So she's landing in that knee flex position, toe to heel landing. Once again, we're looking for flexion angles greater than 60 degrees. That's the beauty of this jump. It really engages the hamstrings, and that is the squat jump. You're going to repeat that for the desired time, and it will progress throughout the phases. In the second phase of the jump program, we move from bounding in place into lateral bounding for distance. She's going to do 4 bounds on each leg stationary, landing nice and soft, and then she's going to move that energy forward, striding each bound, landing in that flex knee position, a more sport-specific movement. Going to walk back and repeat that. Usually we start with 2 runs of this exercise and progress it to 4 runs. This next jump is called the Scissor or Rudder jump. This is one of the more difficult jumps in the first phase. For this jump, we're going to ask the patient to get into a split leg squat position. She's going to jump up, switch her legs. The object of this jump is keeping the chest over the knee. The front leg should hit the ground before the back leg, and we want to try to keep the back leg as straight as possible. This really overloads that front leg. You're getting maximal co-contraction of the quadricep and hamstring during this exercise. As she progresses, we ask her to get more height with each jump. And that is the split leg squat or rudder jump. The next jump we're going to do is called richochets. There's 2 types of richochets. We're going to do front to back and side to side. With richochets front to back, we're going to have her get in the ready position. She's going to jump over a barrier here and then back, landing toe to heel. So it's heel to toe on the front, toe to heel on the back. Soft landings. We're looking for about 18 inches or about shoulder width as far as how much excursion between the feet here. We usually don't start with the barriers, and we kind of add that in as the patient progresses. So this is richochets bilateral, front to back. For the next one, we're going to have her turn sideways, and we're going to do this same exercise, jumping side to side. We also call these mogul jumps. So she's going to get in the ready position. She's going to jump up and over, toe to heel, loading and unloading that knee. So once again, we're trying to decrease the amortization phase, or when the feet are on the ground, using that eccentric muscle strength to rebound, and come right back into the next jump. And that is ricochets bilateral, side to side. Okay, the next jump we're going to do is ricochets unilateral, front to back. So we did bilateral in the first phase. We're moving into unilateral, which was really good at helping athletes develop confidence in their surgical leg. So we're going to get into the same start position as we would in bilateral, but we're going to take that into one leg, and she's going to jump forward and backwards in the same manner, landing softly on the link. This requires an enormous amount of balance on the leg and technique to maintain good alignment of the knee. Good. And then we would switch over to the next foot. Then from there, we're going to move into unilateral ricochets side to side. So same thing, keeping good alignment. We really want to watch that valgus knee moment. We want to make sure she keeps good alignment. And we're going to go up and over the cone and then back. If patients are having a hard time with this one, a lot of times what I'll have them do is put their back leg down kind of like a tripod, touching the toe. That helps kind of balance them a little bit. If they're having a hard time maintaining their good form, that's a good way for them to practice. So that is unilateral ricochets side to side. The last jump in phase 2 of the jump program is called hop, 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 stick. So it's 3 single leg hops in a row, sticking and holding that last jump. So she's landing with that flex knee position. She's going to walk back and switch her legs up. Once again, decreasing the amortization phase with each hop and making sure she keeps good form throughout the exercise.